again, instead of being here, and we'll let Caitlin relax. Okay, I don't want her hand flopping. Talk to you about getting a hand kind of in that epicondyle area and maintaining the humerus in a neutral position, in that neutral 90-degree position. Now you're gonna, again, get under their hand. If you need to, you can come here so you can put some pressure on it. But I'm holding here, so their humerus is not able to move a whole lot. And I'm going to do internal rotation. I'm going to take a couple of fingers, get them right under there. Again, keeping that wrist very neutral. But I don't want the humerus, I don't want to do this. Because I'm not really even getting, I'm never even really getting to an end range on there at all. I'll keep that humerus where it needs to be. And then bring it down. Your horizontal ab and adds, again, just get that wrist secured. And other than that, there's no real change. So little tweaks is all to what you already learned to do. All right, I don't think you spent a whole lot of time on the head, did you? No. Okay. We're going to do some cervical range because we are going to be doing this as part of treatment. Caitlin, slide down. Other way. Go too far. There are different ways that you can hold on to the head, and a lot of this is your preference, what feels comfortable to you. The biggest thing when you're going to work with somebody's head is that you need to keep your hands soft and light on their head. I don't want to be gripping onto her head, right? It's uncomfortable. People are sensitive enough about you touching their heads, coming anywhere near their face as it is without getting a hard grip on them. Any tension you have in your hands is going to transmit right into their head. So you need to keep your hands fairly relaxed on their head. You can use any grip that's comfortable to you. Some people like a one-hand grip on the back of the head. Some people like a hand and back of the head and a forehead grip. I don't really like either one of those. Some people will use both palms on the back of the head and the fingers kind of pointing down the head. Or you can do a cross-hand grip on the base of the skull. And then the thumbs kind of come across those mastoid processes and help you control. Okay, this is my favorite, just to be able to keep my hands loose. I don't have a lot of grip strength, so if I try to hold on to the head in a way that makes me feel like I have to take more of its weight, I tend to get real pinchy on my grip. So to keep my grip light, this is what I prefer, but you can kind of play around with this, try different things and see where you feel comfortable. All right, now, when you start moving the head around, you need to make sure that your motions are slow and that you change directions slowly. We don't want to do a lot of directional changes, so I usually don't take them through huge ranges of motion. I'll usually go all to one, like if I'm going to do side bending, I'll go all to one side first, bring them back to midline, start into the other side, instead of taking on that full sweep left to right. The reason you need to go slow and not huge ranges of motions are so that you don't start messing around with the crystals in their inner ear. If you move them too fast, you're going to make them really dizzy. Okay, and you can't actually dislodge those crystals and give them some dizziness problems. All right, so nice and easy on the grip. Your hand should feel very loose. They shouldn't feel tight like you have a tight grip. And then you can start to go ahead and just relax. Let me do it. Caitlin is not a relaxer. By moving them down on the table too, you can also, if you get your forearms on the table, most of the weight of their head will go through your forearms. So you push into your elbows, will go through your forearms, allowing you to keep your grip a lot lighter on the patient. So I'm tweaking just a little bit on that grip to take her sideways.
It's hard to relax your neck.
It is. Especially when it hurts. Do your extension motions from here. I'm just using my fingers to kind of push up, and my thumbs are guiding that head back. When I do rotation, I usually bring another hand to the top. If you want to, you can keep that hand underneath and kind of catch with your forearm. You do need to watch their hair, especially people with longer hair, so that you're not catching it and pulling it. And kind of, reposition as you go through different motions. But the big thing is, you see how relaxed my hands are? You need to keep those hands relaxed. You don't want to squeeze her head. Okay, that doesn't feel good. Squeeze her head. Okay, so nice, easy grip on the head. All right, go ahead and lift up a little bit. Lower extremity, not a lot different than what you did, other than you need to control the foot position. So I don't really like this grip, because if they're really relaxed, it's going to allow the foot to just kind of flop around. So either here, get a hold of the calcaneus medial-laterally, or a lot of times I'll hold through the heel. As you come down, make sure that hand goes behind the knee, catch the knee, so that you are not allowing that knee to hyperextend.
And then when you get to the top, you want to kind of go to the side?
Mm-hmm.
Okay.
Okay, when you're going to do ab and adduction, again, keep that foot position neutral. As you get up into your rotations, I usually will use a medial lateral grip instead of coming to the heel, because you don't want to do this. So here. And then you're going to just tweak that top hand a little bit so that you make sure you're not twerking on the knee. Okay, go ahead and practice.